Hello, my name is Frances Jose Aliana A. Curva, and for today's video, we are going to show you how the olfactory nerve test works. First thing we have to do is to make sure that her nasal passages are patent so that there's no obstruction that can alter the reliability of the test. So plug your right nose, breathe through your nose, and breathe out through your nose. Also to the left side. Now that we already know that your nasal passages are clear, we can start the test. So please close your eyes and cover your right nostril and vice versa. So now I am going to present a particular smell and she must identify what smell it is. So let's start. So this is the first one. Gulo. Okay, please cover your left nostril. This is the second one. Garlic. So, and this is the third one. Coffee. And now in different orders. This is cologne. Next. Coffee. And lastly, garlic. So she answered it all correctly. If the olfactory nerve isn't working properly and they weren't able to identify those smells, it may indicate something like anosmia.
What we did in this test is called visual fields.
Okay. I'll close my left eye.
We examined the peripheral vision in this
How many
test.
fingers am I holding right here? 2. Okay. How about here? 1. Okay. Now, cover your left eye. Okay. How many fingers am I holding here? 1. How many fingers am I holding here? 2. Okay. Okay, cover your right eye again. How many fingers am I holding here? 2. How many fingers am I holding here? 1. Okay. Now, cover your left eye. And I'll close my left eye as well. Then, tell me how many fingers am I holding here? 2. How many fingers am I holding here? 3. Okay, very good.
Now, we are going to test the 3 cranial nerves observed in tandem. The 3rd cranial nerve, which is known as the oculomotor nerve, the 4th cranial nerve, which is the trochlear nerve, and the 6th cranial nerve, which is the abducens nerve, which are the main function is for extraocular movements. These nerves are responsible for the movements of the muscles of the eye, which is called the extraocular muscles. These muscles are also known as lateral rectus, guided by abducens nerve, the superior oblique, guided by the trochlear nerve, and the superior rectus, inferior oblique, medial rectus, and even the levator palpable superioris, guided by the oculomotor nerve. Let us now start the test. This test is called as smooth pursuit reflex. This test is done to observe that the muscles are working nicely, that no eye is pulling nor weak, and is deviating anywhere. First, orient the patient to observe steady body along with her face while she is sitting. Then, observe the patient's gaze if it is in the midline. After that, instruct the patient to follow your finger only with her eyes. Using your finger, form a letter H to observe the extraocular movements of your patient. Point your finger in the midline, then slide it to her right side to be able to observe the right lateral rectus and her left medial rectus. Next, move your finger upwards to be able to observe her superior rectus and inferior oblique. After that, move your finger downwards to be able to observe her inferior rectus and superior oblique. Next, point your finger towards the left side of your patient to observe the left lateral rectus and her right medial rectus. Then, slide it upwards to observe her superior rectus and inferior oblique. After that, slide it downwards to observe her inferior rectus and superior oblique. Then back to the midline. As we can observe, the extraocular muscles of the patient were working fine. There are no weaknesses or paresis towards one side and are working nice and smooth. No double vision was developed and no nystagmus or little beating was observed. Thus, the patient's extraocular movements were intact and has nice pursued smooth movements.
For this test, we will do the volitional saccades, which is this test can determine the reflexes of the eye movement, which is coordinated by the eye fields and the frontal lobe and the formation pontine, reticular formation in the patient's brainstem. So we will now start the test. So now we will start the test. Look at me, look to the right, look back at me, then look to the left, look back at me, look to the up, look back at me, and then look to the down, look back at me. Okay. So those movements are really fine. There is no stagness or delay from the response of the patient, which we can conclude that the volitional saccades are perfectly working. So that's all. Thank you.
In this test, I am going to test the patient's ability to identify the light touch sensation. So first, we're going to sanitize. Now I'm going to get a cotton swab. So I want you to tell me when you feel a sensation. So the patient must close her eyes first. Can you feel this? Yes. Can you feel this? Yes. We're going to the middle, which is the mandibular division. Can you feel this? Yes. Can you feel this? Yes. Now I'll come down to the maxillary division, which is the V3. Can you feel this? Yes. Can you feel this? Yes. So the damage, she recognized the light touch sensation of the trigeminal nerve, which means that it is working properly. So now we're going to the pinprick sensation. It is an intense stimulus, a little bit more pain stimulus. So I'm going to get a cotton tip applicator and we're going to break it off. So now the patient must close her eyes first. And I want you to tell me if you feel a sensation. Can you feel this? Yes. Can you feel this? Yes. Can you feel this? Yes. Yes. Okay, good. Can you feel this? Yes. Can you feel this? Yes. So the V1, V2, V3 are working properly. And now we're going to move to the motor function, which is the mastication for the chewing. And there are three primary muscles, which is the temporalis muscle, the masseter muscle, and the pterygoids. So I'm going to look for a asymmetry on her face. And I did not observe anything on this examination. So now I'm going to feel for a tone and for a contracting for the activating for temporalis muscle and the masseter muscle. So the patient must clench her jaw. And I'm going to feel the temporalis muscle. And I feel that it is contracting. Now the masseter muscle. And I feel for the tone. Her jaw is clenching. It feels tender when I palpitate around that area. Oh. Good. Okay. The trigeminal nerve is supplying the masseter muscle and the temporalis muscle is working well. Now, I'm going to test the pterygoids. So, the patient must open her mouth and I try to push it down or I try to push it closed. As you can see, it is not easily to close. That it means that from good strength against the resistance. So the pterygoids is working well. Now I'm going to test her corneal reflex. I'm going to get a cotton swab. Now the patient must look straight. And the corneal reflex must trigger the blink. And now as you can see, it triggers a blink. It means that her trigeminal nerve is intact. It means that there's nothing going on trigeminal afferent and nothing in facial afferent pathways.